of December, every year, we commemorate the World AIDS Day, and we are highly privileged today at the program on the Monday agenda to have with us the country director and representative of the UNAIDS Tanzania, Dr. Leo Zekeng, with us. And we're going to look and focus in the next 45 minutes on the World AIDS Day, but looking onto the dynamisms of AIDS in the world, in Africa, and cascaded down to Tanzania. What is the theme for this year, and what are some of the planned activities towards the World AIDS Day?
The theme is about knowing your HIV status, and it's also about knowing your viral load status, because knowledge is power. There's strong evidence that knowing your HIV status is an entry point for both prevention, if you are HIV negative, continuum of prevention, combination of prevention is likely to make sure that you remain HIV negative. It is also an entry point for you if you are HIV positive, so to be initiated early enough on antiretroviral therapy. There's strong evidence that the soonest you start being on antiretroviral therapy, the better it will be for you. Because if you're on treatment early enough, it will reduce the risk, of having AIDS-related complication and then ultimately dying for AIDS. If you are HIV positive and then you start treatment enough, let's take the case of a woman who's HIV positive, that will have benefit, for the newborn. Let's also imagine that if you are in a community, and then each and everybody is tested, put on treatment, it reduces, so the viral load at the community level, and then later on, reduces the risk of transmission, AIDS-related death, and then lets us move, gradually towards epidemic control. There's also evidence that if you do not have AIDS, or if you are treated early enough, you will become more and more productive. So it's all about ensuring that each and everybody in the world, have access to testing, and then also have access to know the status and also know the viral load. So there are a series of activities that will kickstart, as of the 25th in Dodoma, under the leadership of TACAIDS, in collaboration with all the partners. I think there's a marathon, to mobilize resources for the AIDS Trust Fund. There's a symposium where we'll discuss progress, challenges, also opportunities, on the AIDS response in Tanzania. There will be a youth event. Youth are a vulnerable group in the AIDS response. And then on December 1st, we are told that there will be the climax, speeches, testimony. And if we are lucky enough, it's being indicated that His Excellency the President might grace, the occasion. So it's a good moment, to reflect, on the progress that we've made, on the challenges that we are faced with, and really to, again, break the silence and let people know that we've made progress, but it's still an unfinished business.
You've mentioned in your early explanation that as soon as you know that you're infected with HIV, you should start the treatment.
It's as soon as you are tested.
Yeah, as soon as you're tested and you test positive.
And you test positive.
But there, people just talk left, right, and center that as soon as you're tested, you're not to start the medication immediately. There are levels to start medication. Can we break this uncertainty?
In those days,
yes,
going back to the response, we've moved from a situation where when somebody was HIV positive, you will not initiate the treatment, to a certain threshold of the response.
Correct.
We used to talk about the CD4.
CD4s, yeah.
So the CD4 was a level where if you're not below 200 CD4, we aren't going to start the treatment for many reasons. We could elaborate a little bit more on that. We then move into a level where if you were not below 350 CD4, we're not starting the treatment. Later on, we move into a level of 500 CD4 before we could start the treatment. Now there's evidence that regardless of the level of your CD4 count, regardless of the level of your immune system, there's strong evidence, so published by WHO and recommended by WHO, that the test and start on the long run will have more benefit, so from you, rather than waiting to a certain level of immunity, so to kickstart the treatment. And this is for many reasons, so we've made progress in the tools to enable people, so to be diagnosed early enough. In those days, we do not have rapid tests, so of point of care technology. Those tests, so are readily available, and then in less than few minutes, so you can have your status. They are self-testing, which is available, today. We've also made enough progress, so in a response, in moving into drugs which will be more efficacious, which will lower your viral load, so within the next 3 months you initiate treatment. We've moved into drugs with less side effects. So the combination of the science, the innovation, and then the program, and then the evidence that we are having strongly suggests the soonest, if you are HIV positive, the soonest you start your treatment on the long run is going to be beneficial for you, for the couple, and for the community.
You've mentioned things like self-testing kits. If these are available, don't you think if the promotion of this could probably increase the number of people testing? Of course, there will be no records, but at least people will know their status and probably engage to the 90-90-90, which in response probably for the sake of our viewers, you can also tell us about the 90-90-90.
I really want to commend the government, TACAIDS, the Ministry of Health, the Office of the Prime Minister, for taking the bold leadership in launching this campaign in June on the testing. With Test and Start, we focus on men, and boys. We've seen in the AIDS response across the world and then many countries that when you have the leadership at the highest political level possible to make AIDS a priority and mobilize people around AIDS, there's no doubt that the continuous political leadership really makes a difference. So we really want to commend the government. We want to commend His Excellency, the Prime Minister, for taking that lead. We also saw the Prime Minister last year launching the symposium. We saw the Prime Minister gracing the celebration of PEPFAR at 15.
Correct.
My wish is that as long as possible, we get the Prime Minister, the Vice President, and the President, so to really say this is an unfinished business. So really to commend that leadership. Number two is that leadership was leadership that was specific towards testing and start the treatment. Why? Because from the impact assessment that was conducted last year, unfortunately we did realize that the first 90, which talks about people knowing their status, that unfortunately in Tanzania, a little bit more than 60%, to be honest, 62% only of people in Tanzania knew their status.
62%?
So only
that's
62%.
That's a huge number. That's a big success?
It's a big number, 62%, but when you compare that number, so to the global average,
Correct.
the global average is 75%. When you compare that performance, so to other countries in the region, so it wasn't one of the highest.
Okay.
So it's as a result of that study that, so the Prime Minister, with the support of partners, decided to launch that campaign to make sure that more people, especially men, because men are lagging behind, less than 50% of the men living with HIV and AIDS know their status. So there was a specific focus in ensuring that the men, wherever they are, can have access, so to the HIV testing, will know the status, and then be enrolled into care and in ensuring that they are virally suppressed later on.
Okay, so
That's the cascade. But as you rightly mentioned it, I think one of the challenge that people face, so in knowing their status, it's about the stigma and discrimination, but it's also more about the accessibility. So wherever will be made available in such a way that in your room, so you can go into a health facility, you can go into a pharmacy, buy a self-test, which is not a diagnosis test, but which is an indication test, which tells you that if I'm positive using a self-testing, I need to go to a facility, so to be tested at that level and being known. So we are working very closely, so the Ministry of the Government in such a way that the HIV self-testing, so will be made available, so pretty soon in such a way that those who are scared because there's fear, there's stigma related to HIV
absolutely.
testing.
Yes.
You can go and then buy your test, so, and they're very easy to use, so it could be done using a finger prick, or it could also be doing, using an oral device, which within 5 minutes, will tell you yes or no that you need to have a confirmation. But remember, when a self-test is not a diagnosis test. It's an indication, so that you need to go to a health facility, the nearest health facility, to have it confirmed. So I'll agree with you that putting in place all these different mechanisms, so the testing at the facility, at the community, or even self-testing, are a combination of different approaches that obviously will ensure that we get to the first 90. The first 90 is a situation where 90% of the people in HIV and AIDS are diagnosed. If they are diagnosed, the second 90 is about ensuring that 90% of those who are HIV positive are on antiretroviral therapy. And then if people are taking antiretroviral therapy, is to reduce, so the viral load that lead into the third 90, which making sure that people are virally suppressed. So the theme, know your status, but also know your viral load status in such a way that you can live a comfortable life.
In your opinion, are we making progress, or are the numbers increasing for infections?
You mentioned UNAIDS, TACAID, but we also need to commend all the other Ministry of Health,
Ministry of Health,
very closely.
Yes.
Minister of Agriculture, the Prime Minister's Office in charge of the Minister of States in the Prime Minister's Office, in charge of Parliament, Youth, Labour. So I think they also need to be commended.
Okay.
We also need to commend other UN agencies, so WHO, UNICEF, UNFPA, ILO, who are doing a great job.
Yes.
We need to commend, so funding agencies like PEPFAR and then the Global Fund that are contributing a huge amount of resources to fund the response in this country.
Yes.
We also need to commend, other organizations in the country like AMREV, so like Mkapa Foundation, NACOFA, the Association of Living People of HIV and AIDS, to bring here, so the needs of a continuous multi-sectoral approach, so in addressing the AIDS response. When you look back into Tanzania, when we look at the evidence, new infections have been on the increase.
Have been on the increase.
No, new infection has been on the decrease.
Decrease, okay.
New infection has been in the decrease. If we look at the data between 2004 and then 2017, new infections have decreased by almost 30%. So I think this is something which is commendable. Okay. When we look at the number of baby born to HIV and AIDS, also it has decreased. As we speak, it's about 10,000. 10,000 is a decrease, but 10,000 is still quite a number. When we look at the number of people who are on treatment, in Tanzania, there's about 1.5 adults and children living with HIV and AIDS. So as we speak, there's a little bit more than 1 million people who are on treatment. This is also commendable, okay? But it is important that we sustain those efforts, because though the new infections have declined, we are now more and more seeing a situation where about 40% of the new infections are occurring in the age group 15-24. This is not really very good. We need to really make sure that we have specific programs that are targeting young people, especially adolescent girls and young women. So I think this is an area, so where we really need progress. When we look into the treatment, okay, there's about 1 million plus people who are on treatment, but the men are lagging behind. So less than 50% of the men, so who are living with HIV and AIDS are on treatment. The third area where we really need to make effort, it's an area of stigma and discrimination. Stigma and discrimination remain a major, major challenge. And then the fourth area where we really need to make sure that we make progress, it's not only making sure that we utilize the resources that we are having, but gradually we find ways and means in the country to see how we can reduce, we can increase, so the domestic resources, and then reduce the external dependency. Let's make no mistake, so there'll be one day that the resources that we're receiving, the response in Tanzania is funded more than 90% by external resources. So I think this is something that we need, so to address that. Why am I saying that we need to scale up and then reduce primary prevention and intensify primary prevention? Why am I saying that it is important for us to identify the men, so test them and then put them on treatment? Because this country has a legitimate ambition of becoming a middle-income country by 2025. So where is your growth going to come from? Your growth is going to come from the agri sector. Your growth is going to come from the transport sector. Your growth is going to come from the energy sector. Your growth is surely going to come to the services that we are providing. And you will agree with me, if unchecked, if the young people and then the men and then the women working in those sectors, so are not healthy, so they are not educated, so there's a strong likelihood, so that this could jeopardize, so our goal, our dream to become a middle-income country. I just want to draw here the parallel, so between ensuring that we address HIV and AIDS, but other health-related issues, because if not addresses, it will obviously impede, so that economic transformation and then social development.
Do you think there's a need to change approach towards this, specifically this age group? Because 2025 is another 9-8 years to come. And the 15 to 24 are the ones who will be at the backbone of, they'll be the ones driving the economy. What ought to be done so that, we reduce especially new infections, or we get them to the 99 to 90, so that, we leave the economy onto safer hands, healthy people? You've said that the new infections, the rate for new infections is on the decrease.
The new infections is on the decrease overall.
Overall.
But when you break it down now, by age, by sex, by region, you then realize that we're not decreasing enough. Remember, we've got a target. If we want to be on track by 2020, it should require a reduction of 75%. So you can compare that 30 as compared to 75, we still have a good back. But coming back to your key question, so on why is it that, so we're not on track to meet the prevention target?
Yes.
I think it is important, one, that we are mindful, that we tell, our viewers that we know what to do to reduce new infections. The key question is why is it that we're not doing what we're supposed to do? Or what are some of the shortfalls that we have experienced in the past? Number one is that when you talk about prevention, there's no single approach that will solve your problem in terms of prevention, right? You need a combination of different interventions, which is related to structural intervention, for instance, keeping girls in school, we'll get into that, ensuring that in the community people can have cash transfer. We're working closely with the Global Fund, TACAIDS, and then TASAF towards that. Number two is what we call behavior. It is important to change the behavior in terms of reducing, for instance, the number of sexual partners. It's in terms of using condom when we're having sex. It's in terms of, increasing your early sexual debut. And then thirdly, what we call biomedical intervention. For instance, there's intervention which is called the PrEP, which is a pre-exposure prophylaxis. So what we have done in the past is that we've been using fragmented approaches. So what is important here, what we need to do differently is a comprehensive approach. That will imply that you need a multi-sectoral rather than coordinated approach that will bring together all the key players. What we also have not done well in the past is opposing prevention versus treatment. It is not prevention or treatment. It's both prevention and treatment working hand in hand. So now moving forward, and then based on what I have said, it is important that Tanzania, which is one of the countries of the Global Prevention Coalition, that we get the leadership around prevention. Leadership is at the government level, leadership it's at the community level, leadership is about the champion. Who is it in the Tanzanian society, so that people can emulate, so people to whom young people can listen to. So really the leadership around prevention is something which is important. The second point which is important around prevention is around our focus. So we know in the context of Tanzania that young people contribute to about 40% of new infections. So we need targeted and then tailored information. So it will require knowing where those young people are, so what are their needs and so on and so forth. We also know in the context not only of Tanzania, that key and vulnerable population, so do contribute a lot in new infections. So we need specific program for that. So the focus on the group, the focus also on the regions. We know in the epi burden in Tanzania, heart burden disease, so there's also a need to have a specific focus on those regions. So the focus is something which is important. Thirdly, to the advantage of Tanzania, when we look at the penetration of cell phone in your society, especially among young people, I think we should be able to use technology and innovation SMS, WhatsApp, charge on the information. Where is it that they can have access to services? The fourth area, which is important, is the allocation of the resources. Most of the fund that we have now, most of the fund, are geared towards buying the commodity for the treatment. So what UNAIDS is coming and then promoting, it's a quarter for prevention. About 25% of the entire resources, allocated should go, 25% of those resources should go to prevention. Last but not least, is the scale and then the intensity. We've seen in many countries in the world that if you are promoting condom, and if those condoms are available, utilization of those condoms will increase. So what are the mechanisms that we put in place that, for instance, a commodity like condom, it's widely accessible, so when you need it, so being at midnight, being at 2 p.m., being in Dar es Salaam, on everywhere. So ensuring that, so those commodities are available, that we don't stock out, are key success in ensuring that we gradually and drastically reduce new infections and then be on target by 2020. Now, we spoke about young people and then adolescent girls and young women.
Yes.
I'm happy to report, so that UNAIDS and then other UN agencies, we've been part of a process funded by the Gates Foundation, working in collaboration with Dalberg in Tanzania, under the leadership of the Ministry of Health, so in having an accelerated agenda to invest, so on adolescent girls and young women, with a pillar on HIV prevention, but also on gender-based violence, a pillar on teenage pregnancy, a pillar on nutrition. I think there should be another pillar on economic opportunity.
Absolutely.
And then last but not least, keeping girls in school. There's strong evidence from all over the place that if girls spend an additional year, so in school, it reduces the risk of transmission, the risk of acquisition of HIV and AIDS by at least 20-25%. So we hope that this program will be finalized pretty soon, and UNAIDS and other development partners will be ready. We are committed in supporting the government of Tanzania, so to launch, scale up those high impact, comprehensive, you saw the pillars.
Yes.
It was not specific to HIV and AIDS, but it
broad.
took that really broad. So maybe this is what we haven't done enough, so in the past. Coming to your question, and then what needs to be done differently.
You mentioned earlier on stigma, that those infected with HIV/AIDS clearly say that it's not the disease or HIV related that really put them down, but the stigma. What, in your opinion, ought to be done so that we reduce? I do not know it can be ended, but reduce to 90% stigma reduction.
The goal as part of the 3-0,
yes,
it's zero stigma and discrimination. So as part of the 3 zeros, so stigma and discrimination.
But how do we move it from from theory into practical?
I told you that not only in Tanzania, we've made great progress in putting people on treatment. We've made great progress in reducing new infections. Where the progress is really very slow, it's around reducing stigma and discrimination. And it is not unusual that people will be telling you that I don't want to go and know my status because I'm afraid of HIV-related stigma and discrimination if I'm HIV positive. When you will discuss and then have conversation with our great friend of NACOFA. NACOFA is the National Council of People living with HIV and AIDS of Tanzania. They're doing a great job. they will be telling you that one of the things that they are faced with, so it's the stigma and discrimination, the way the community look at them, like if they've done something wrong, so.
Yeah.
If you will be discussing, I was discussing with somebody last week, he told me, so that he was moving from point A, so to point B to have access to the treatment and care and support. And then I asked him why. He said, so in this facility, I know somebody, so if he sees me taking antiretroviral drug, it will not be for me. So really a major, major barrier, obstacle that we really need to address is about stigma and discrimination, the fear which is related.
Yes.
So stigma and discrimination towards people living with HIV and AIDS, but I also will say the stigma and discrimination, the fear and then the violence that put some of the groups, like the key and vulnerable population, I'm talking about the men having sex with men, the female sex workers, the people who inject drugs, and then the transgender. This fear and stigmatization will make them go on the ground, and then as a result, they will not want to seek the services as part of the right to health. So now, what is it? What we have seen in other countries, and that we begin to see here.
Yes.
Stigma and discrimination among healthcare professionals, it's a major challenge. You'll be surprised that, so in our health facilities, the doctors, the nurses, and whatever it is, from the different survey, they will not even want to touch somebody who's HIV positive.
Yeah.
They will be wearing 2, 3, 4 gloves. There's a recent survey, so published in Tanzania by HP Plus, so in 2 health facilities, showing that stigma and discrimination, it's still a major impediment. So what other countries have done as best practice is to train the healthcare professional. So a survey will be done in the beginning. There will be an intervention. And then at the end of the intervention, you will see a reduction, so of those negative perception, attitude, and so on and so forth. So I think this is something that needs to be brought to scale, so not only in those pilot health facilities where HP Plus has been working, but throughout the entire health facilities in the country. So it's something which is possible. It is something which requires our attention. It is something which requires resources, because if the services are there, then the people are not utilizing the services, it's not cost effective. So really, stigma and discrimination in health settings, number 1. Number 2, I also think what we have seen in other countries, there's a project which is called PACT. It's a coalition of young people, so in at least 20 countries, in ensuring that we can challenge the policy environment, because some of the practices are still criminalized, changing the laws and then the policies, criminalizing same-sex relations, so it's something that those people are working on, looking at the policy environment and then the laws which are in countries. The third thing that we are seeing, using an example of linkages. Linkages uses technology in such a way that key and vulnerable population can report, that can be on SMS, reporting on the attitude, so on the healthcare provider. Fourthly, I think the media has a key role in educating people, so that you can eat in the same plate as somebody who is HIV positive. Absolutely. You can share the same cup. You can shake hands. You can live the same office. So what is it that we can do, so with the media, not only on what is there, but really constantly, in such a way that people are reminded, so that stigma, discrimination, and sometimes the violence which is related to stigma and discrimination, it's something which is not acceptable, because those folks have the right to live, they have the right to health. The other thing that we're working with NACOFA and then IDLO and then TACAID has to do with the literacy, so know your right campaign, okay? If you look into the constitution of Tanzania, I think there are several amendment or several sections of the constitution, so about your right to do so many things. And then in addition to that, this country have signed so many body treaties in the world, so that need to be applicable. So people in this country need to know what are their rights, what is it? It's your right, so whether you're HIV positive or not, whether you are engaging regardless of your sexual behavior. When you go to hospital, so you should have access to those services. So your Know Your Right campaign, the literacy campaign is something that we're working very closely on. Last but not least, second to the last, is a situation where we do provide legal aids. What if your tenant knew last week that you were HIV positive, and then as a result, he said, I will not renew your lease. What if, so your employee knew that you were HIV positive, and then as a result, the stigma and discrimination, so at employment, so right? So those who have had the right, so abuse, so the right, those who have the right abuse need to be in a situation where they are provided legal aid. And I have said last but not least, working around gender equality,
Yes.
and the women empowerment. So this is something which is comprehensive in addressing stigma and discrimination, the fear, the lack of confidentiality, the ensuing violence, which will make sure that people will run away, they will not have access to the services, and then in so doing, they will continue transmitting the viruses.
15 to 24, my main focus are the people today with, Android, all this technology in their hands. How can we use these tools to actually increase awareness, knowledge, get them interested to, get into the first 90 at least? Issues around
access to services.
Access to
services,
Yes.
so being in the position where there's so many, there are different apps today and then models. You remember?
But how do you get a young person to actually, out of a blue, download an app that speaks about what if you're HIV positive, what services you need, what legal aid you need,
I think again, it's one, we need to get back to the facts and then the basics and realize that we've made progress.
Yes, we have.
But we're not there yet.
We're not there yet.
So we need to realize that if we're complacent, the epidemic will rebound. Okay, so we need to get that fact. We also need to be in a situation where we have to roll our sleeves, re-energize ourselves, use the evidence which is available to see who are the drivers of the epidemic. Thirdly, once you have that, how do we draft and elaborate programs which are specific for the group, then get them involved? So the participation of those young people, those adolescent girls and young women, those key and vulnerable population, to the design, the implementation, and the monitoring and evaluation of the program, it's something which is extremely important. So coming to what you've said, they will tell us, you'll be surprised when you meet with them, that most of the time we try and we want to decide for them, but they know exactly what they have. So once that information is available, using existing platform, they'll be able to tell you. And there's so many programs around, so that were there before. I'm forgetting some of those names, so targeting young people.
Yes.
It's about kind of reviving them. It's a kind of acknowledging that it's an unfinished business, give it the necessary energy, leadership, resources, accountability, and ownership, and then you see that we can make it. Our main challenge in the AIDS response today, it's about complacency. It's about denial, and we do not have a problem, or it's about resistance. Let's join hands together in Tanzania, with the support of the international community, behind the leadership which has generated and then emanated from all spheres of the government, get the community involved in such a way that we can achieve the 3 zeros in Tanzania: 0 new infections, 0 related death, 0 stigma and discrimination, and move into an AIDS-free generation by 2030, on the understanding that will have helped us realize the Vision 2025, which is so dear to the current leadership. Thank you.
With those remarks, I would like to end the program today, the Monday Agenda, as we advance towards the commemoration of the World AIDS Day, with the quotation from Michael Sidibe, who is the Executive Director of UNAIDS. Until next time, I'm your host, Makani, and thank you for watching the Monday Agenda.